Schizophrenia. 20 symptoms and treatments of this mental illness. Written by Albert Rogers. Narrated by Matthias J. Introduction. I personally know some people in my immediate circles who have been diagnosed with schizophrenia, so I decided to analyze this disorder and really align the most important things you need to know about it. I don't know what prompted you to pick up this book, whether you already knew people with a schizophrenic mind or just got curious, just in case you do meet someone who is dealing with this disorder. Let me assure you that schizophrenia is prevalent enough that you'll be confronted with an individual or two at some point in life, and that it does help to learn more about it. With this book, you'll deepen your understanding, and you'll be more inclined to comprehend the complicated processes in a person's mind who innocently gets haunted by some of the difficult symptoms of schizophrenia. The information in this book is correct and accurate, and you will find that it will make sense, especially when you observe these symptoms in an individual you know or meet. Additionally, I will provide possible solutions for handling the disorder. As with many disorders, every person is different, and some solutions may only minimize the negative effects of the brain's malfunctioning. Others may help you work miracles as you notice significant progress in the individual's happiness and fulfillment in life. I encourage you to read through the pointers and notes in this comprehensive guide to understanding schizophrenia. One. Definition and delineation. Before discussing any of the deeper questions, let's begin with the most basic one that lays the foundation for all our understanding of it. What is schizophrenia anyway? For some reason, the popular media and the most common perception of schizophrenia is that of a split personality. This is false. Schizophrenia, despite its many possible symptoms, is in no way synonymous with having a split personality. Another myth is that those who have schizophrenia pose a constant threat to others. This is also false. The majority of those with schizophrenia are harmless, and I know what I'm talking about from first-hand experience, after interacting with several. The stats don't lie, and the fear of the unknown should be eliminated. Hopefully, I can enlighten you with the facts in this book so that erroneous concepts vanish from your understanding. So, what is it then? Schizophrenia is a serious, draining brain and behavior disorder that affects one's thoughts, feelings, and actions. Someone who has schizophrenia can have a hard time separating fantasy and reality. Something that became clear to one of my family members, who recalls whenever there was a scary part in a movie, he would just run away. For children who are 6 or 7 years old, this makes complete sense. But my schizophrenic brother still did it when he was 15. They can have difficulty expressing their emotions, controlling their feelings, or making clear decisions. Additionally, thought processes can be disorganized, and the motivation or passion to get something going could be minimized at certain times, thus leading to depression more often. Those who have schizophrenia may hear imaginary voices, something I have personally seen someone with the disorder express, and believe others are reading their minds, controlling their thoughts, or plotting to harm them. This is overly suspicious attitude may be noticeable in some and lacking in others. For example, the same woman I talked to mentioned that her cousin with schizophrenia thinks her aunt is a government spy, which is very unlikely. But her schizophrenic brother doesn't come from the same paranoia when it comes to people he knows. However, he does go on and on about how the US government is out to get us, and convincing him to eliminate gun rights is, therefore, never a good idea, since it always ends up in a heated discussion. The majority of those with this condition suffer from symptoms either unceasingly or sporadically throughout their lives, and are often severely defamed or judged by others who don't understand it. Nevertheless, the symptoms are scary to those who are afflicted by it and can make them insensitive, disturbed, or solitary. Those with this condition attempt suicide more frequently than the majority of the population, and stats and estimates are based on a 10% risk the completion of a suicidal attempt within the first 10 years of illness, especially young men with schizophrenia. Although schizophrenia is a chronic disorder, it can be treated with medication, psychological and social treatments, substantially improving the lives of people with the condition. Despite the fact that I have only met male schizophrenics in my personal life, studies show that schizophrenia affects men and women equally. It occurs at similar rates in all ethnic groups around the world. Two, symptoms. After lightly touching on the symptoms of the disorder, I still think it's essential to go deeper and broaden our perspective. The way the disease manifests itself in someone differs from one person to another. The duration and severity vary, and how fast someone progresses and is able to overcome or handle these symptoms all relates to their background, environment, personality, and resistance to temptations, weaknesses, and outside forces. To clarify the symptoms even further, I have divided them into 3 different categories, according to different reliable resources: positive, negative, and cognitive symptoms. Positive symptoms. By the word positive, I don't mean beneficial, but rather symptoms that get added to their thought patterns and behaviors, which the general population doesn't experience at all or in the same degree. With this word, I am referring to something they feel that others don't, being the opposite of the negative symptoms that imply specific qualities or skills they lack or have in a lesser degree than the average person. Positive symptoms can include hallucinating, delusional thoughts, inner voices, and, at times, psychomotor problems such as clumsiness, forgetfulness, strange repetitive actions and routines, or awkward rigidity. A person close to me with schizophrenia, for instance, shows patterns of leaving his stuff at other people's places, forgetting what he was doing, or some other disorganized, chaotic way of neglecting the blandly obvious things in life, like brushing teeth or remembering an appointment. Delusions, hallucinations, and inner voices are collectively called psychosis, something that also appears in those with bipolar disorder. Delusions can make people feel too suspicious of someone's motives or become paranoid of being followed, stalked, or monitored. Hallucinations cause patients to sense, see, feel, or smell something unreal. Thought disorders may involve difficulty putting cohesive thoughts together or making sense of speech. Negative symptoms. This indicates symptoms that cause a loss in a certain behavioral area or brain activity. Emotion and motivation are 2 of them. I know someone who has several signs of schizophrenia but hasn't been diagnosed yet. He doesn't want to do anything in life, says he is okay with becoming a bum, and shows little interest, if any, in pursuing a career or becoming self-reliant. Typical for schizophrenia patients is the inability to speak up, enjoy life, express their emotions, or initiate plans. Emotional flatness, passive resistance to initiative, social withdrawal, apathy, etc., which sometimes get confused with laziness or depression. Cognitive symptoms. Because in a patient's brain, sensors can get overloaded and the frontal cortex deviates from that of the average person, there can be problems with attention and memory. This means that they can get distracted easily, get addicted to the digital world, something I have seen a lot in those who have schizophrenia, and tend to be forgetful, which I mentioned earlier. Planning and organizing can be harder for someone with this disorder, and the results tend to be more chaotic and disorganized. These deficits stand in the way of many of them who try to lead a normal life. Three, Subtypes. As I mentioned before, which should be obvious, every person with schizophrenia is different. Although certain symptoms are easily distinguishable as a general standard, an indication that someone has schizophrenia, and although these recognizable symptoms enable us to better understand them by shoving them into a category, there is another deeper layer that helps us more specifically pinpoint the kind of brain activity and deviate mindset a patient is suffering from. Therefore, according to psychological terminology and accurate research, I have maintained the same categories as have been found and determined by those who have studied this topic more elaborately. These subcategories, or subtypes, are paranoid schizophrenia, feelings of extreme suspicion, persecution, or grandiosity, or a combination of these; disorganized schizophrenia, incoherent thoughts, but not necessarily delusional; catatonic schizophrenia, withdrawal, negative affect, and isolation, and marked with psychomotor disturbances; residual schizophrenia. Delusions or hallucinations may go away, but motivation or interest in life is gone. Schizoaffective disorder. Symptoms of both schizophrenia and a major mood disorder, such as depression. 4. Age. The symptoms of schizophrenia may be apparent when kids are young, but they typically do not get recognized as signs of schizophrenia. This is because many of the symptoms only appear at a later age. When someone with schizophrenia is young, people may see their behavior as autistic, Asperger's disease, or some other disorder. We clearly saw this in one of our family members, who had always been a little different than others, but who had some sort of emotional breakdown or burnout at age 21. It occurred when he got too many responsibilities, and when he stressed out because of a lack of consistency in the events happening around him. Just like those who have autism, someone with schizophrenia may have a harder or slower time adapting to change, because his or her thought processes are different, which sometimes just means slower. Therefore, one of the ways to help those with schizophrenia is to establish predictability and consistent routines and patterns. This was not the case in our family member at the time, which caused him to stress out and experience the clear signs of schizophrenia, which included hallucinations, hearing voices, the obsessions with being perfect, a lack of sleep, crazy talk, and randomly approaching people in the supermarket. Once we got him on medicine and helped him to eat and sleep more regularly, he partially recovered and came across as more sane. The psychiatrist mentioned that this was typical, to have the signs appear at such an age. According to scientists, hallucinations and delusions begin between the ages of 16 and 30. Men usually experience these symptoms earlier than women. After 45, the chance of getting schizophrenia is very low. And even though schizophrenia doesn't occur in children, the onset and the likability of being susceptible to it can often be noticed by the keen observer and well-informed therapist or caretaker. In teens, schizophrenia is difficult to diagnose because the first signs could include changing friends, a drop in grades, sleep problems, or becoming more easily agitated. Since these behaviors are common among teenagers anyway, it's often challenging to attribute them to schizophrenia or just regular teen drama and the everyday struggles of someone in that age group. 5. Diagnosis. One can predict whether someone will have a psychotic breakdown in the form of schizophrenia or not, to some degree, so that surrounding family members, friends, and professionals can intervene more readily when extreme symptoms become apparent. A combination of factors can predict schizophrenia in up to 80% of kids and teens who are at risk of developing this disorder. These are some signs to look for that predict it pretty well. 1. Isolating oneself or withdrawing from others. 2. Irregular thoughts and suspicions. 3. A family history or hereditary genes related to psychosis. This stage of the disorder, when these symptoms appear, is called the predominal period. I have personally seen this in some people who have been diagnosed with, or bear many of the symptoms of schizophrenia. They talk about being incognito, anonymous, disappearing ninjas, pretending they are invisible so nobody can see them, sneaking around, disappearing from society, and they shy away from social settings. Of course, not every kid who is socially awkward or plays ninja games has many of these symptoms. Hey, I played ninja when I was a kid, but I have none of the other symptoms. Kids can have any of these symptoms and be only somewhat autistic, in a difficult period of their life, talented when it comes to developing a great imagination, etc. But when you see the genetic history, the siblings, the patterns, and certain other quirks that seem to be out of the ordinary, then don't rule out the chance of schizophrenia when diagnosing or predicting the disorder. However, these symptoms need to occur increasingly or more regularly over a long period of time, like several months, for example. A sudden one-time occurrence doesn't guarantee or suggest anything of the sort, and jumping to conclusions needs to be avoided as much as evading the putting on of labels to prevent people from thinking that your son or daughter is crazy. Something too many parents who refuse to help are afraid of, with all the consequences of not getting help and enhancing the severity of the symptoms. For someone to suspect schizophrenia in an already special needs individual, one must see 2 or more symptoms, like hallucinations, disorganized speech, random mumbling, delusions, stiff behavior, or an inability to cope with regular patterns or simple changes for several months. In the case of voices being heard that aren't real, or hallucinations in any form, one can assess the likability of the disorder, taking into account the personal circumstances of that individual, the time period of the symptoms, and the social or occupational problems that play a role as well. Researchers are working on developing more immediate intervention methods, as well as a greater understanding of how the environmental and genetic mechanisms form the brain cells that cause schizophrenia. As more is discovered about chemical circuitry and structure of the brains of people with the disease, better diagnostic tools and early intervention techniques can be developed. This is crucial for schizophrenia, as it is believed that with every psychotic episode, increased damage is done to the brain. The stress can be so high for them that scientists have presumed literal physical damage being done to the brain cells because of an overdose of anxiety, cortisol, and other negative additions. Cure and manageability. Even though, unfortunately, nobody has found a real permanent cure for schizophrenia yet, it is treatable and manageable with medication and behavioral therapy, particularly if the patient gets diagnosed early and treated continuously. This is why denial that there is something wrong with your child is hurting him or her more than if some of the odd behavior would be admitted as a serious problem and a possible disorder. Saving a few bucks on a therapist may not be as beneficial to them in the long run, when problems increase in severity and their lives and self-awareness have become less manageable. Patients who are experiencing critical problems, like serious delusions or hallucinations, suicidal tendencies, or the inability to care for oneself, may require hospitalization. Antipsychotic drugs currently are the best existing medications to decrease the various symptoms of schizophrenia. These have a positive effect on the brain's neurotransmitter systems. With the help of cognitive and behavioral therapy, the brain can be adjusted and symptoms can be brought down to a minimum. When an individual with schizophrenia cooperates and allows these trainings to have an impact on his or her life, coping mechanisms can be taught so that person can improve communication skills, get motivated, take better care of him or herself, attend school, get a job, or socialize. Regular psychosocial treatment helps such a person to cooperate when giving medication and reduce relapses and hospitalization. If the person with a disorder has a good relationship or friendship bond with the therapist, he or she is more likely to recover from relapses or the stresses of life. Seven, electrical stimulation. When I am talking about electrical stimulation, I am referring to a method called transcranial direct current stimulation, TDCS. Among others, it has been used to help those who have had strokes, as well as Alzheimer's and Parkinson's disease patients. It's non-invasive and without risks. A weak, small electrical pulse that can rearrange the alignment of the senses and brain tissues. TDCS is a technique in which a direct electrical current is passed through the cerebral cortex via electrodes placed on the scalp. Donald M. Martin, PhD of the University of New South Wales, who used a 2010 NARSAD Young Investigator grant to conduct studies with TDCS, says the method can potentially help the brain activity and inhibiting competing brain regions. Unfortunately, more research is needed to acknowledge if cognition related to psychiatric illnesses can be improved and help more than the original treatment sessions. It has been proven helpful in the past when it came to symptoms of depression, and it could be an option to be considered and discussed with physicians and clinicians. Eight, relapses. The first thing you need to do to prevent relapses and the negative effects of them is to recognize when relapses are occurring or most likely to occur, so that you can predict them with full confidence. Relapses are common because the tension in life and the vicissitudes that go with it constantly require people to adapt. Those with schizophrenia, this may be harder than to other people since they greatly benefit from consistency and routines. A relapse usually doesn't happen suddenly, and it is accompanied by other preceding symptoms which could include insomnia, anxiety, stress, tension, restlessness, depression, the inability to focus, less eating, being disorganized, disappearing unexpectedly, mood changes, having strange ideas that make no sense, poor personal hygiene, chaotic thinking patterns and weird conclusions, aggressive talk, suicidal thoughts, smiling for no reason, actual aggression, and/or breaking things. These are the predominant signs that precede a psychotic episode. I saw these in my specific friend when he had a psychotic breakdown. Responsibilities were too much of a burden for him. He couldn't handle the stress and sudden changes anymore, and he stopped sleeping and eating, which only made it worse, because he couldn't think straight anymore. Back then, we didn't know what we were dealing with, but the first things the psychologist recommended were melatonin so he could catch up on sleep and specific medicine for schizophrenia. Other symptoms may include withdrawal from social interaction, excessive preoccupation with religious ideas, and drastic changes of appearance. Increased irritability, sadness for no particular reason, and extreme anxiety are also options. When I learned about this, it was very interesting to me, since my friend randomly went to people in the supermarket and began talking to them, saying that they were great and perfect people, and other nonsensical phrases. He was obsessed with religious ideas and became more preachy and interested in spirituality, quoting random Bible scriptures and claiming he heard evil voices that kept him awake. He smiled a lot for no reason, and he talked about suicide or taking a knife and hurting himself in the kitchen. All of these things happened several days before the breakdown, and it is exactly those prodromal signals that should be regarded as warning signs and a call to intervene with medicine and/or professional help. When schizophrenia is under control and the symptoms stop, it may be tempting to think it is all over, but relapses like this can happen, which means the symptoms come back. If any of you notice the prodromal signs which are a prelude to a relapse, contact your doctor right away or adjust treatment and medicine. Always check if that person is still taking his or her medicine. Here are some tips to avoid relapses. 1. Take medicine as instructed, even if symptoms aren't evident anymore. One of the most common causes of relapses is patients who quit taking their medicine. 2. Completely avoid alcohol or illegal drugs. They make symptoms worse and are a big cause of relapses. 3. Find more positive ways to manage stress. Stress is one of the biggest symptom triggers for those with schizophrenia. Take it easy, take a break, and don't wear yourself out. Find healthy ways to relax. 4. Exercise for at least 30 minutes per day. Exercising is very important. If you have to, find a program, a class, or a partner so you can stick to this routine. 5. Get enough sleep. This is extremely important. A lack of sleep makes the brain go nuts. This could happen to any person, but more particularly to those with schizophrenia. 6. No caffeine. This will just keep you awake and worsen the symptoms. 9. Crisis. Reversing the symptoms of a could-be psychotic breakdown is essential, and regarding to that, preventing the symptoms from escalating is the main purpose of any professional, bystander, friend, or family member dealing with someone who has schizophrenia. One of the things you can do, and this has been tested, is speaking softly and in simple sentences. People will seldom lose control if they are approached in a soft, gentle way. This way, sleeplessness, stress, ritualistic preoccupation with specific activities or topics, suspiciousness, or sudden outbursts will be less likely to occur. Do nothing to agitate the patient. If you feel threatened, then protect yourself and take immediate action. The more psychotic the patient is, the less likely you will have success. As mentioned before, psychosis can be prevented by reacting to the symptoms in the early stages, the ones that precede the psychotic breakdown and mania. Remember that the patient is probably scared because of the loss of control of feelings, behavior, and thoughts. The voices may come in different forms, and they may form a threatening message to the person who is victimized by his or her own twisted brain. Hallucinations may beseat that person, and he or she may act out accordingly, like trying to kill the snakes that he or she sees crawling through the window, thus shattering the window to end it. Always remain calm, no matter how hard this may seem in such a situation. If you are alone, call someone to stay with you until professional help arrives. If the patients must be hospitalized, avoid patronizing or forcing, and ensure him or her that going with you voluntarily will have the most positive outcome for everyone. If it goes too far, the police might have to come. Always explain the mental illness to them and assure them that the use of weapons won't be necessary. Here are some other things to avoid: threatening, yelling, criticizing, blaming, arguing with other family members, standing higher than the patient, saying no to requests unless they are endangering or beyond reason, blocking the doorway. Fortunately, my friend with schizophrenia did not act out aggressively. He was a very friendly person with no history of anger issues, and he did not come across as a threat to others. However, caution should always be taken when dealing with those with schizophrenia, and the above advice is still valid. 10. Self-help. Fortunately, most patients with schizophrenia improve over the years. Stats have shown that at least 20% will get better within 5 years of the first symptoms. 60% will get better, but will still have the occasional symptoms, and only 20% will still have troublesome symptoms in the years to come. Sadly, recovery from schizophrenia means nothing more than coping with it. A schizophrenic's life may never be completely free from symptoms. But with that being said, a patient's life may still be creative, purpose-driven, satisfying, and blissful. The two most helpful factors of therapy and medication can be combined with self-help, which can motivate and push a schizophrenic's desire to achieve and go somewhere worthwhile. The encouraging thought here is that schizophrenia is treatable, even though it's not curable. If a patient believes this, he or she will be more motivated to make changes. Another thought is that those with schizophrenia can have happy relationships, valuable professions, and participate in meaningful activities. Just because you have schizophrenia doesn't mean you have to be hospitalized a lot. My friend never got hospitalized, and with the help of medication, support from family, and a professional, he was able to get over his psychotic episode quickly. Also, keep in mind that most people with schizophrenia improve, as indicated earlier, and that there is no reason to despair. Other self-help strategies include 1. Stick to your diet. Don't stuff yourself with unhealthy food, and exercise enough. Participate in stress-relieving activities. Seek social support. Listen to your therapists and doctors. Take a little step to achieve things so that your self-esteem will get in the way of any suicidal thoughts that may occur. 6. Change your attitude to schizophrenia and see yourself as an intelligent, capable person who just needs a little help. You are not crazy. In fact, you probably have certain talents nobody else possesses. My friend was an expert at chess, programming, and math. Yes, he was a little geeky, but if you ask me, he had quite the impressive skill set. An employer once asked him to perform a specific task in 10 days. He did it in only a day, and every detail was executed perfectly, and all of that without a college degree, being self-taught through taking courses and watching YouTube videos on the internet. 7. Try to distance yourself from any delusional thoughts that may come your way. Just realize that sometimes the way you look at things may be a little exaggerated or influenced by schizophrenia. This way, you can ignore maleficent voices in your head and stay free from the consequences of hallucinations. 8. Have a goal plan. This may work even better for you than some other disorganized people who don't know what they want. My friend with schizophrenia used an internet video game that was focused on goal setting to get points for every little deed of exercise, work, study, cleaning, or other useful activities. His obsession became collecting points, but it kept him on track, and he accomplished a lot more just by being motivated by a system of simple rewards. 9. Don't allow family to deny the fact that you have schizophrenia. Nobody likes a label, and parents will often go through extensive lengths to deny that their child is not normal. Face reality and deal with the consequences without thinking that there is something wrong with you, whatever that means. I mean, seriously, isn't there something wrong with all of us? We all have to work on our flaws. (11) Activity. The effects of exercise reach far beyond what many people comprehend. Regular exercise can manage symptoms of schizophrenia, help you sleep better, and digest food better, and relieve stress. People aren't made to sit still. They are made to move. Exercising gives you more energy to accomplish things, prevents psychotic episodes, and makes you feel calmer. Trust me when I say this. The moment I am running, I feel awful. I feel like I am out of oxygen, my legs could collapse, and like I am getting dehydrated. But the moment I come home, shower, and lie down on the couch, I feel better than ever before. That's just how sports work. Ideas for exercising are swimming, running, dancing, playing ball sports, working out at the gym, or just going on a walk. 12. Individual support. Watch out for loneliness. Isolation and being alone all the time make you close off yourself from the rest of the world. Human beings aren't meant to be alone, or even to feel alone. Although, unfortunately, there are many people who feel that way. So regular contact to connect with trusted individuals is important. You need people to take you seriously enough and won't criticize, distract, or judge you. The support of others can truly prevent relapses. Trusted friends and family members form the basis for such a support group. But you can get social support at work, volunteer projects, church, or in other circumstances as well. You can also join a schizophrenia support group, which is something that may help you feel understood more. I'll expand on that later. The last option is mental health clinics. You could look them up and see if it's something that you would be interested in. Most times, these clinics have trained professionals and staff who know exactly how to assist you. 13. Managing stress. Stress is the biggest thing to avoid, especially in this modern age of electronics, pressure to perform, individualism, and time management. I personally know more people who have overworked than people who are lazy or bored. I see phone messages and notifications all day long, whether it's on my own phone or someone else's. Today is a fast-paced society, and living with a difficult emotional disorder doesn't make things easier. If you are not careful, the tasks, responsibilities, and pressure to accomplish more than others can drive you nuts, as it can with any other person. If stress occurs, high levels of cortisol, the stress hormone, get released, and these chemical fluids may trigger psychotic episodes. I already mentioned exercising, dieting, and staying connected. But here are some more quick tips to manage stress. Make use of relaxation techniques for stress relief. Mindfulness, meditation, deep breathing, yoga, listening to music, or progressive muscle relaxation can help your mind and body and put you at ease. When I was in Asia, I heard some Buddhists say, when you feel anxiety, focus on breathing. People who are angry breathe fast. If you breathe slowly and deeply, you can more easily control your emotions. Be aware of your limitations. Don't try to do more than you can handle. You don't want to feel overwhelmed. Control your emotions. Balance your moods and maintain control over your life. Accept negative emotions, such as anger, sadness, disappointment, or frustration, without beating yourself up about it or letting others tell you that you cannot feel this way. Just control the way you express them. Here's another book that can help you when you are trying to control your emotions. Emotional Mastery by Rita Chester. 14. Taking care of yourself. This is something that may sound obvious, but for some schizophrenics, it is a special challenge. You see, when your brain is more disorganized at those moments that you just don't know anymore, it is hard to keep up with the regular things of life. My friend with schizophrenia, for instance, has a hard time keeping track of his stuff, and simple routines such as keeping track of PayPal expenses and purchases, brushing teeth, or flushing the toilet, you could say he is just sloppy, sometimes, and he is probably not to blame for it. Whenever he comes over, there is a high chance he leaves a jacket, a book, a bag, or a cord at our place because at the time he leaves, he is a little scatterbrained and just forgets about it. However, he never forgets his laptop because he is very attached to it. Besides the daily challenges, I noticed something else in him. When he had a psychotic breakdown, which only happened twice, one time worse than the other, he didn't sleep or eat enough, which became a huge problem. Make sure you involve these things in your schedule, even when you are obsessed or just very interested in a particular topic or activity. 15. Medication. Medication is essential, and I cannot emphasize it enough. Yes, even a skeptic like me, when it comes to taking pills and all the useless stuff out there in the corrupt industry of medical assistance, is convinced that the medication prescribed by those who diagnose someone with schizophrenia is valid and useful. Medication is not a cure, understand that, but it provides relief from severe symptoms like hallucinations, delusions, paranoia, and disorganized thinking patterns. Lack of motivation or emotional expressiveness, as well as social skills, cannot be helped. But those are things you need to work on yourself and with others. The downside of medication for schizophrenia is that it can have annoying side effects, which is why some patients don't want to take it anymore. Drowsiness, uncontrollable movements, weight gain, less energy, and sexual dysfunction have been reported by the faithful users of it. It's important that you know exactly how much you should take. So, consult with your doctor on the minimum. Never reduce or stop taking this medication on your own without asking for advice from professionals. They should be the only ones who can estimate the right dosage. Sudden unsupervised quitting can have dangerous consequences and can cause relapses more easily. Typical antipsychotics have a track record of successfully treating paranoia and other psychotic symptoms. They are a little older and are prescribed less frequently because they can have extra pyramidal symptoms like tremors, temporary paralysis, slow movements, restlessness, muscle spasms, or changes in breathing and heart rate. Long-term intake of schizophrenia antipsychotics can cause dyskinesia, which can cause involuntary facial tics in the tongue or mouth, or uncontrolled tiny movements of limbs, trunk, or feet. The risk is only about 5%, but it is still there. Because a lot of patients need medication for longer time periods, sometimes their whole lives, it is crucial to find out the best dosage is so the symptoms can be minimized while still benefiting from the positive effects and the antipsychosis effects of the medication that has been prescribed. People are different, and every medication will have a different effect on a different person. Therefore, it is not set in stone, and it is a trial and error process to figure out the perfect fit for the best quality of life. Also, it takes some time for antipsychotic medication to take effect. Some only take several days, while others may need a few weeks or even months to have the desired effect. If the effects aren't significant within about 6 weeks, help should be sought after. Other medication may be complemented aid to help you control other aspects of your psyche, like antidepressants or anti-anxiety drugs that can help the brain's neurotransmitters and dopamine dosages. Some people are more vulnerable to some ways of taking medication than others. For this reason, some patients prefer taking injections over taking pills, and others may prefer the opposite. Second-generation antipsychotics. As briefly mentioned in the previous points, there are older and newer medications, each with their own risks and benefits. These are the newer medications, the second-generation medications that pose a lower risk of serious side effects, but still can have some side effects like drowsiness, weight gain, reduced energy, or sexual dysfunction. These newer improved antipsychotics can be aripiprazole, Abilify, acinapine, Saphris, brexpiprazole, Rexulti, cariprazine, Vraylar, clozapine, Clozaril, iloperidone, Fanapt, lurasidone, Latuda, olanzapine, Zyprexa, paliperidone, Invega, quetiapine, Seroquel, risperidone, Risperdal, ziprasidone, Geodone. 17. First-generation antipsychotics. Since finding the right medication for the individual's needs is a trial and error process, some prefer the first-generation antipsychotics, which can have neurological effects like movement disorder, restlessness, or muscle spasm. I mean, choose your own poison is really what it comes down to. The best fit will be an individual's and doctor's choice. make sure you take the advice from your psychiatrist seriously. The first-generation medication is often cheaper than the newer ones, especially generic versions, which can be a good long-term solution when needed. The first-generation medication could be chlorpromazine, flufenazine, haloperidol, perfenazine. (18) Psychosocial interferences. Social skills and stress control can be acquired by the right motivation and help. Psychosocial interference can be done by coaching or in group therapy sessions. Some patients choose to participate in improving their communication skills, social interactions, and daily activities normalization by following a specific training program. Some programs include family therapy, where they involve the schizophrenic's family members. Others focus on more job-oriented skills and employment gain so that the individual with the disorder is more likely to find a sustainable job and take care of him or herself. Sometimes, depending on where you live, there is a financial or self-dependency program supported by the government, a charity, or the locals that specifically help people with schizophrenia stand on their own 2 feet. Some provide housing, vocational skills, and other treatment and life necessities. (19) Therapy tips. In individual psychotherapy, a psychiatrist teaches the schizophrenic to deal with his or her thoughts and reactions. The therapist can also help the patient to distinguish reality from imagination and manage everyday life. In cognitive behavior therapy, the focus is on minimizing psychotic episodes and learning to deal with voices, delusions, and hallucinations. Psychosis will be prevented through advice and medicine. Then, there is cognitive enhancement therapy, or cognitive remediation, which helps patients to recognize social signs, triggers, or improve their memory, attention span, and attentiveness. This kind of therapy focuses on organizing one's thoughts, and it often includes computer-based brain training and group sessions as well. And last but not least, there are self-help groups which are like addiction recovery programs. These outreach programs help with working on social skills and sharing. The National Alliance on Mental Illness is such an organization. There are 10 sessions for patients with a mental illness in it, and it is for those who want to learn more about themselves or a loved one. (20) Final tips. In this book, I've already given a lot of tips. Here are some final words. Take these things to your heart and help yourself or your loved one to cope with schizophrenia. 1. Learn more about it. The more information you have, the better. You already took the first step by learning the basics through the information in this book. But I am sure there is a whole library out there with other sources that can enlighten you and expand your mind further. 2. Take notes when you go to the doctor. This may seem simple, but it can help you to better remember and understand the disorder and the steps you need to take to minimize the negative effects. Take notes about the symptoms, the past experiences, other medical conditions, new sources of stress, and changes in life. Vitamins, herbs, or supplements the patient or you has taken, etc. 3. Learn how to react to the person with schizophrenia. It doesn't help, for example, to tell him or her that the things they are seeing or hearing aren't real, because even if they aren't, he or she still senses them. It's better to say that you see things in your own way. Respect, friendliness, and support are crucial. If the patient feels threatened and tensions arise, make sure to avoid eye contact, because this will enhance his or her feeling of insecurity. If the patient threatens to commit suicide, don't ever leave him or her alone. Call for help. 911 if needed, if you live in the USA, of course, or the local emergency number in any other country. 4. Get the Psychiatric Crisis Resources Kit app. This is downloadable on your iPhone or other device. 5. Know the signs of suicidal tendencies. People with schizophrenia are more likely to hurt themselves than others. If they talk about suicide, take them seriously. Pay attention to anecdotes, notes, poems, or subtle comments. If he or she goes from depressed to cheerful, don't trust it. This can all be an act, and this change could mean he or she is thinking about committing suicide. Stay suspicious when something like this happens. 6. Keep contacting them. If a schizophrenic is left alone too much, suicidal thoughts may increase. Stay in contact via texting, email, mail, telephone, Skype, or the occasional visit. Remind them how much you care. That was it. I hope you enjoy the information in this book. I certainly put my heart into this, since I personally know someone close to me with schizophrenia. Thanks again for buying my book. If you have a minute, please leave a positive review. I take reviews seriously and always look at them. This way, you are helping me provide you better content that you will love in the future. A review doesn't have to be long, just 1 or 2 sentences and a number of stars you find appropriate, hopefully 5 of course. Also, if I think a review is useful, I will mark it as helpful. This will help you become more known on Amazon as a decent reviewer and will ensure that more authors will contact you with free ebooks in the future. This is how we can help each other. Take a look at my other books too. Hoarding, OCD, Midlife Crisis, Bipolar Disorder. This has been Schizophrenia, 20 Symptoms and Treatments of This Mental Illness. Written by Albert Rogers. Narrated by Matthias J. Copyright 2017 by Albert Rogers. Production copyright 2017 by Albert Rogers.